This is page 105, the in-person gallbladder stones story. This first-person narrative describes the symptoms and treatment of a 46-year-old woman with gallbladder stones. Everyone enjoys a little dessert after dinner, but when the ice cream or a creamy tart leads to pain, most would avoid it. I loved sweets, and despite the revenge they took on my waistline, I still would not pass up an ice cream cone, until my gallbladder decided it had had enough. After several late nights spent doubled over in pain, I tried to steer clear of fatty foods, but could not resist the temptation of frozen yogurt. With one hand, I pushed my cart through the supermarket. With the other hand, I fed myself some delicious, low-fat, not non-fat, frozen yogurt. I never dreamed that the attendant at the quick service window actually gave me soft serve ice cream. Within 10 minutes of eating the questionable yogurt, I broke out into a sweat. A wave of nausea took me over, and a knife-like pain stabbed me in my right upper quadrant. It hurt even more when I pressed my hand on the area in an attempt to brace the pain. Several months earlier, after a similar painful episode, I had undergone an ultrasound of my gallbladder, and the surgeon then recommended cholecystectomy. The ultrasound showed multiple stones in my gallbladder. Most of the stones were just the right size to lodge in the common bile duct and cause blockage of the outflow of bile that occurs after a fatty meal. When I heard the ultrasound results, I swore off all fatty foods. I just did not imagine that ice cream masquerading as low-fat yogurt would be the straw that broke the camel's back. Soon enough, I abandoned my shopping cart and apologized to the manager of the store for vomiting all over aisle 4. The unrelenting pain did not cease when I vomited. It only intensified. I have no idea how I made it home and into bed. I managed to call my surgeon and arrange for semi-emergent surgery the next morning. Dr. Fernandez and his team performed a laparoscopic cholecystectomy and relayed to me as I came out of anesthesia that I no longer had a bag of marbles for a gallbladder. I had a gassy, distended feeling in my abdomen over the 2 weeks after surgery. Carbon dioxide gas is injected into the abdomen before surgery to allow space between abdominal organs. I felt tight as a drum for the first few days, and then day by day it went away. My 4 tiny incisions healed just fine, and in about 2 weeks I was feeling back to normal. Now I can eat ice cream to my heart's content, only suffering the padding on my waistline, not the stabbing pain just above. Without missing a beat, my liver now delivers the bile into my small intestine right after I eat a fatty meal. The bile emulsifies or breaks down the fat. I just don't have a storage bag to hold bile in reserve. I've had an appendectomy, my wisdom teeth removed, and now I gave up my gallbladder. How many more useless body parts are there to go?